Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Persistent fetal lobulation. Persistent fetal lobulation is actually a normal variant of the kidney. This persistent fetal lobulation is a normal variant which is seen in adult kidneys. And this persistent fetal lobulation occurs when there is incomplete fusion of the developmental lobules. Here the kidney develops from lobules. If there is incomplete development of the fusion of the developmental lobules, so the kidneys in the lobules will persist like that, resulting in persistent fetal lobulation. Embryologically, the kidneys originate as distinct lobules and they fuse and they grow. Now, this persistent fetal lobulation can be diagnosed by ultrasound or CT or MRI. In all these, you will see that there is smooth indentations are seen of renal outline between the renal pyramids. So, between the renal pyramids, you will see the indentations are seen of renal outline. Like for example, if this is the kidney and these are the pyramids, between the pyramids you will see that there are indentations are seen like this. Okay, so these are the different lobules which are developed. Actually they should fuse, but here there is incomplete fusion, thus you can see these smooth indentations are seen. Then, so this persistent fetal lobulation should be distinguished from renal cortical scarring, because this renal cortical scarring most commonly also overlies on the pyramids. So we should distinguish this renal cortical scarring with the we should distinguish this persistent fetal lobulation from renal cortical scarring.
thank you and thank you for watching.